Welcome, and thank you for joining us today. This is Food Procurement for a More Just Food System. My name is Nessia Berner-Wong, and I'm a Senior Policy Analyst with ChangeLab Solutions. Before getting started, I wanted to go over a few housekeeping tips or notes for participants. On the left-hand side of your screen is a Q&A box. If you're having any technical difficulties during the webinar, send a question through this box and we'll try to help you out. If time permits, we're also planning on answering a few of your questions at the end of the webinar. Throughout the webinar, you can submit those questions for presenters in that same Q&A box. If your question is for a specific presenter, please remember to identify them in your question. And if we don't get to the Q&A before the end of the hour, we will try and stay on a little longer to answer a few participant questions, and you're welcome to stay with us. And finally, the webinar will be recorded and sent out to all webinar registrants early next week. A quick introduction of ChangeLab, if you're not already familiar with us. We're a national law and policy organization that's located in Oakland, California. We work to advance equitable laws and policies to ensure healthy lives for all, and we prioritize communities whose residents are at highest risk for poor health. I am super excited to have a really wonderful group of folks with us today to speak about food procurement. I'm going to have each speaker introduce themselves and their organization that they're representing today. And I'll jump off first. My name, again, is Nessia. I'm a Senior Policy Analyst at ChangeLab, and I work on food systems policy, including procurement. And my background is in food security, public health, and federal nutrition programs. And I'll pass it off to Elizabeth to introduce herself.
Hello, good afternoon, everybody. My name is Elizabeth Reynoso, and I'm an Associate Director at Living Cities. Living Cities is a collaborative of 19 philanthropic and financial institutions. We harness the collective power of philanthropy, financial institutions, and local governments to close racial, income, and wealth gaps in American cities. My background includes being the former Food Policy Director for the City of New York.
Hi, everyone. My name is Jessica Gilbert, and I'm in Buffalo, New York, which is located on the traditional territory of the Haudenosaunee, or Six Nations. I identify as a white female. I prefer she, her pronouns, and I'm a research associate at Partnership for the Public Good, which is a policy research and advocacy think tank with over 300 local partner organizations. Each year, our partners vote for the top 10 issues that PPG will address throughout the year, and the Good Food Purchasing Program has been voted onto this agenda the last 2 years, and this is what I'm going to focus on today. I'm also a PhD candidate studying geography, food justice, and the GFPP at the University at Buffalo.
Hello, everyone. My name is Allison Dehoney. I am the founder and owner of Urban Fruits and Veggies. We're an urban agriculture organization. We have 2 urban farms located in Buffalo, New York. We have a mobile produce market, and our focus is on wellness and underserved communities. I am also the chair of the Food Policy Council of Buffalo and Erie County. I come from a corporate background, so I left corporate America in insurance and finance to start Urban Fruits and Veggies approximately 5 years ago.
Thanks, Allison. So here's a brief look at what we'll cover today. First, I'm going to go over food systems and a good food approach, and then we'll go into procurement and how that fits into the connection between procurement and health equity. And then I'll pass it off to our speakers, who will dive into the good food values of local economies and a diverse workforce. And finally, we'll share some resources and answer some of your questions. And now to our just food system. So I can't talk about food systems, and certainly not about building a more just food system, without honoring and acknowledging the communities across the nation that are protesting the murders of George Floyd, Ahmaud Arbery, Breonna Taylor, Rayshard Brooks, and sadly, countless others. The structural violence against Black people that protesters are responding to is the result of a long history of laws and policies that discriminate and disenfranchise. These laws and policies that have perpetuated a legacy of slavery, of white supremacy, of segregation, and of disenfranchisement are the most powerful risk factors in health. They are these same risk factors driving racial disparities in health and economic outcomes in the midst of the COVID-19 pandemic. Health equity cannot be achieved until we address this anti-Blackness that comes from insidious discriminatory systems, structures, and practices, not just of the policing and criminal justice system, but also in our schools, healthcare, housing, and in our food system. Policies across the food system, including in procurement, can be leveraged in this effort. Policymakers and governments and funders and advocacy organizations and educators, including organizations like ChangeLab, all play a critical role in the decisions that shape our communities and can push back at the fundamental drivers of health inequity. With that context, I think the food system does provide a unique opportunity to shape the health, environment, social, and economic outcomes of communities. The food system is broad-reaching. It's one of the largest industries in terms of employment, and so it's a key ingredient in reversing the fundamental drivers of inequities. Each component of the food system, from production, processing, distribution, consumption, and disposal, influences those outcomes. But that does not occur in a vacuum. The way that we approach food systems, the values that we place at the core of our approach, that drives the activities in the food system supply chain. And a food system that values local economies, that values diversity in business, a valued workforce, nutrition, environmental sustainability, and environmental welfare, those can help shape a community's or a region's outcomes. So let's draw out the specific connection between procurement and health equity. A definition that we have used for health equity from the National Academies of Sciences is the, quote, state in which everyone has the opportunity to attain full health potential, and no one is disadvantaged from achieving this potential because of social position or any other socially defined circumstance. And for everything I've set up until this point, let's push that up to the systems level and add, because of structural discrimination such as anti-Blackness. So the foundation of this concept and the concept of health disparities is the understanding that the differences in health experienced by these populations are unjust, they are avoidable, and don't result from genetics or biology, but from the systemic discrimination and social exclusion. And in the context of food procurement, addressing health equity requires a total reframing of institutional purchasing that intersects with health in ways that go beyond just nutrition and healthy food access. And to use it as a tool for achieving health equity and justice in food systems, we need to see procurement as a strategy for creating good food jobs, economic development, racial equity, and environmental sustainability. This is an infographic that we developed with the Center for Good Food Purchasing. They're an organization that's leading the charge to shift institutions towards a values-based purchasing model. To demonstrate that this framework for how equitable food procurement as one activity that occurs within food systems can contribute to a more just food system. And it might be a little late here, but I do want to clarify what we're talking about when we say procurement. Procurement is the process of finding, contracting for, and acquiring goods or services. Local government agencies, school districts, and other large institutions like hospitals and universities are often some of the largest food purchasers in a community. And they're also an important source of food for community members. Americans eat more than a third of their calories outside of the home. And with this purchasing power and the standards and criteria that are driven by good food values that they use to find and select their food supplies, they can address structural drivers of inequity like structural discrimination, income inequality, and disparities in opportunity. So to go back to the idea of using good food values in procurement to drive food system activities, here are a few examples. For valued workforce, 1 out of every 7 workers in the U.S. works along the food chain. But a lot of those jobs come with very low pay, poor working conditions, and no benefits. The procurement policies can help to demand better conditions for these workers. For environmental sustainability, if U.S. public schools, for example, reduced their meat purchases by 30%, they could reduce their carbon footprints by 700 million kilograms at very little extra cost. And for health and nutrition, consider who typically eats food served by governments and other institutions. Most often, this food is served to people from groups that are already at increased risk for or overburdened with diet-related diseases like hypertension and obesity. Examples here might include low-income seniors or children from food-insecure households, people living in institutional settings such as correctional facilities and psychiatric hospitals. Valuing health and nutrition can shape this food environment. Elizabeth, Jessica, and Allison are going to go deeper into two more of these good food values, local economies and diversity in business. In the most simplest sense, leveraging institutional dollars for local economies can keep dollars circulating in a region so that they can stabilize and grow local economies. And supplier diversity programs can counteract disparities in access to opportunity for diverse businesses, including ones that are owned by women, people of color, veterans, and people with disabilities. There is much more to both of these values, so I'm going to pass it off to Elizabeth first to take us further into diversity in business. Jessica will follow up after her with local economies, and then Allison will take us into both of these values and their impact, potential impact on communities on the ground. So I will pass it off to Elizabeth.
Thank you very much, Nasia. Again, I'm Elizabeth Reynoso, and as I mentioned at the top, I was a former food policy director for the city of Newark, New Jersey. Now, I work with Living Cities, and that means working with cities around the country on closing racial, income, and wealth gaps. But I have to tell you, we didn't always acknowledge race in our work. In fact, we would say we want better results for low-income people faster. Now, 7 years ago, we began a process of reckoning with the fact that despite successes along the way, we had not achieved widespread progress. And in fact, income inequality and racial disparities have become more pronounced than ever. Living Cities' vision is that all people in U.S. cities are economically secure and building wealth and living abundant, dignified, and connected lives. Our values are racial equity and inclusion, collaboration, innovation, leadership, and impact. I'm sure many of you share some of these. But let me focus on racial equity and inclusion. Why is it important? Well, if inclusion is being, let's say, invited to a table, to a meal, then racial equity is ensuring that those who have been on the menu are deciding what the menu is and benefiting from the meal in terms of connections and the wealth generated. If you want to know the business case for racial equity, let me take it from one of the members of Living Cities, Kellogg Foundation. They had a 2018 report called The Business Case for Racial Equity. And they said combined impact of disparities in health, incarceration, and employment results in $2.7 trillion fewer dollars in economic output. Kellogg Foundation also estimated that the tax revenues could increase by up to $325 billion for state and local governments, and the national GDP could rise by 22% simply by addressing the racial wealth gap. So folks still ask me, can't we just talk about equity? Why do we have to talk about race? Well, when we talk about race, we often think about it as something that is personal, about a person. Am I a good person? Am I doing the right thing? However, disparities, inequities function as a system that has many parts that work together. That's a quote from Shakti Butler, who's the director and producer of Cracking the Code. So the system I want to talk about today with you is the procurement system, and in particular, how government and institutions could better use their purchasing dollars to achieve racial equity outcomes. But public procurement does not live in a historical, political, or social vacuum. Therefore, current efforts should be framed in the context of past legal, economic, and social challenges, so you can form solutions to undo centuries-long legacy of active discrimination and anti-Blackness. So when you look at this slide, many of you are familiar with some of this history, that of wealth accumulation being impossible, redlining being in place, and then later on in the 80s, there was a landmark case, Richmond versus Croson, that supported putting a strict scrutiny standard on state and local governments that wanted to have remedial contracting programs. So when you think about this historical context from a national level, it's important to also think about how did these play out locally. And when I talk about locally, a lot of what I'm sharing with you today are lessons learned from my local work with folks in local government. So, and why? Because local governments have, aggregate and spend $1.5 trillion a year on goods, services, and construction. So Living Cities felt that this was an area in which we could have an impact on the racial inequities in income and wealth if we worked with local governments to improve the way that they use their dollars so that they could achieve racial equity outcomes. And so here are some of the benefits. In general, they're focusing on procurement to achieve broad community impact. It has common sense and quantifiable results, like more robust taxpayer base, community wealth, investment in health and the environment, higher local employees, local resilient, diverse supply chain. That these are some of the ways that cities have seen tangible impact in their communities when they have used their values to increase the diversity of vendors with whom they work with, and also the processes that they go through once they become vendors with local government or with institutions like the medical institutions and educational institutions. So you might be wondering, what have folks been doing now during COVID? Have things changed? If you're in a city, you probably know how rapidly things have had to change in terms of your procurement processes. Here are 4 examples of procurement during COVID that I think are examples of cities that have maintained their values throughout in order to achieve racial equity outcomes. Some of you know the story of Gooder in Atlanta. They are a food waste diversion company that partnered with the city, and the city contracted them to provide meals to seniors and youth, but they're doing much, much more. They have pop-up grocery stores as well, and it's all because Jasmine Crowe, the founder, always believed that food insecurity is a logistics problem. So because of her efforts to work with the city of Atlanta and with other communities, maybe some of yours on the call, she in turn too has been able to source from more vendors, including Mississippi farmers and Louisiana farmers, to be able to bring their goods to folks in cities outside of theirs. Another example is the city of Chicago. Mayor Lightfoot was working on a massive public health campaign to make sure that folks were staying home and staying safe. And it was important for her and her city to ensure that if she was going to be creating a media campaign, that she would make sure that she was sourcing, not exclusively, but intentionally with media agencies, PR agencies, to create a campaign that was very much targeted to the Black community as well as the Latinx community, by also engaging companies owned by people of color. And so you might know the For Jason campaign that was used in Chicago and elsewhere. In the city of Minneapolis, they contracted with 29 organizations to strengthen the capacity of mental and behavioral health providers and community cultural healers to provide services to residents, particularly residents of color, who may be experiencing increased stress and trauma related to the outbreak of the coronavirus. The city used their own dollars to create an emergency health fund that provided services that range from like $2,500 to $7,500 to ensure that culturally competent mental and behavioral health services were provided to the community. And then the city of Houston was concerned about how social distancing might make it challenging for new vendors to be able to become certified with the city. So their certification officers started conducting virtual vendor site visits to facilitate certification for small businesses. They administered the certifications that were required so that folks who could be subcontractors on city projects would have the opportunity to. And they were able to comply with all the social distancing guidelines using Zoom, making it possible for business applications to continue to be processed and be listed for credit subcontractors on new bids or proposals that were being released and continue to be released by the government and related projects. So these are just 4 examples, not all food related obviously, but ways in which cities maintained their values and applied it to how they purchased and who they purchased from. So for those of you who are not procurement professionals, I definitely was not one, but I've learned from those who have been practicing this for a while. So I want to share with you in the next 5 slides or so, ways in which you can partner with your purchasing and procurement experts, your colleagues. And so these are tactical ways to increase equity in your cities and when you are making your food purchases or in your organization. So the first one is assessment of local vendors of color. MBE is a term for minority business enterprises. I choose not to use the word minority, but that is an acronym that is well known in the procurement field, as well as a bunch of other acronyms that include women or diverse. I'm sure you all are familiar with that alphabet soup. But it's important to know what the availability and capacity is of potential food manufacturers, service providers for your needs. And so many folks start off with ensuring that they have a good sense of what who the vendors are and what their capacity is. And so just doing that might take a lot of study. But you can also see, I gather, from colleagues, whether it be at different levels of government, like if you're in the city, you might ask the county. If you are, once again, in local government, you might ask your partners and anchor institutions who they purchase from and work with their diversity supply folks. You can ask your chambers of commerce if you haven't already. But it's important to keep reviewing this list of vendors because new ones come up all the time. So finding ways to identify them is important and keeping that up to date. Some cities have done an analysis or disparity study. That requires a little bit more investment and takes a little bit more time, but from that you get the sense of how many potential vendors are in sectors that are important to your city and how well you've already been working with them, engaging them, contracting with them. And so you can identify what disparities there are in your city's current purchasing. Others might consider going regional. I just got an email from folks from the city of Richmond, and once again, not a food-related procurement need, but you can imagine something similar where the city of Richmond is looking for a contractor to support the call for and the decision to remove Confederate statues. And so they thought it was important that this work be done by a contractor who is a vendor of color or an MBE. So they reached out in the region because they they couldn't identify any local folks who would be able to do this. And doing so, they were able to identify a host of folks to do it, including from New Orleans, because New Orleans had already removed some Confederate statues. Also, another way that you can increase equity is by simply doing outreach. One of my favorite people who has done this work well out of the city of Memphis has said to me, you cannot over-communicate opportunity. So when you have bids for any of your food purchases, think about the ways that you are doing outreach. You probably already are partnering with as many people as possible, but look again. Identify, are you working with the chambers that are like the African American Chamber or the Hispanic Chamber? Are you working with faith-based organizations? Once again, you really cannot over-communicate. Also, think about how often you are communicating what your purchasing needs are. Can you do any forecasting so that newer, smaller businesses who might not have contracted with you again before would consider contracting with you and be able to put in a successful bid because you've given them the information ahead of time, not just giving the information, the bid or proposal, having that out when there's like a really quick turnaround. I know because of COVID there have been those instances, but when you can, if you can forecast and share your citywide buying plan, that makes a big difference to smaller businesses who have not been part of the process before, so that they can prepare or partner with others to be able to put in a successful bid, prepare inventory, consider their hiring. Next, as I mentioned before, the example of Austin on certification and verification, find out what are your existing requirements for certification and verification. Does it have to be a local business that is certified? And if you haven't certified them, does that exclude them from being able to put in a bid or proposal? And what can you do to ensure that certification is not a barrier? Is it simply to be able to do virtual visits, having Zoom calls? That might be one way for you, as it was for the city of Houston. And if you don't have, if a business is not already certified by you, might you be able to consider or accept their certification from, let's say, another level of government or another organization? If they're already working with a local university, will your organization or your city be able to accept that as a proxy for certification with you? These are questions that are important that also save businesses owned by people of color with so much time and money so they can focus on their business without having to run around trying to go through all the hoops of getting certified with multiple agencies. Then when you are procuring, it's so important that when you put together your bids, and many of you probably already know this, that you are clear in the language about communicating your values, that if you have goals in terms of participation of vendors of color, that you do include those so that they know that they're invited, or if you're getting a contractor that might need a subcontractor, that they know that that is something that would be favorable for them to when they are putting together their application if they had already a subcontractor that was as a vendor of color. Also, I know it's challenging to not aggregate, it's easier to aggregate your purchases and not have to go to multiple vendors, but breaking apart large contracts and bid packages really do make a big difference for, once again, the newer and smaller businesses, the businesses that might not have been considered before, and that will help them get a smaller contract, will help them build their capacity for larger contracts down the line. And in the process, thinking about how you are using vendors of color that align with your goals, and also what kind of incentives can you include that would increase or attract and signal to vendors of color that they are welcome and invited into the process. And finally, if you're asking yourself, well, locally we have prohibitions. If those of you are calling from California, you have Prop 209, you're like, we can't have a race-conscious program. I understand there's local jurisdictions that say the same, but you can still achieve meet your values and achieve your goals in increasing your procurement to include vendors of color for your food purchases, even with race-neutral efforts. And on the left, on the slide, there are a bunch of race-neutral efforts that you could employ. And if those of you are on the call are aware that your jurisdiction can have a race-conscious approach and implement in your program mentor-protege programs or strategic or joint venture training specifically to support entrepreneurs of color getting contracts with you, that's the table on the right. I know this is really small, so you don't need to read this on the slide. You actually can get a guide. It's a free guide that's written primarily for practitioners in procurement, but also their partners. And it is on governing. It's governing.com/city accelerator. As I said at the top, many of these lessons were learned from our work with cities across the country, approximately 15 of them, that have said that increasing the number of vendors of color in terms of numbers and in terms of contract amounts was important to them to close racial income and wealth gaps because they understood the impact on their health, on the environment, and community wellness. Thank you very much for listening, and if you have any questions, I'll talk to you at the end. And I will pass it on to Jessica.
All right, hi everyone. Sorry, mute was not working very well for me for a moment. Today I am representing the Good Food Buffalo Coalition, which is working to bring the Good Food Purchasing Program, or the GFPP, to the Western New York region. The GFPP works to leverage institutional procurement power to promote just food systems by helping public institutions to spend public money in a way that reflects public values. These values, which Nessia touched on before, are nutrition, local economies, valued workforce, animal welfare, and environmental sustainability. The GFPP focuses on passing policy at various levels of governance in order to enable public institutions to pursue values-based purchasing. So our coalition kicked off in Buffalo in April of 2018 and is now comprised of over 20 local member organizations representing all 5 values of the GFPP, in addition to local and national partners who also support our work. Since 2018, our coalition has collaborated to educate ourselves and our communities about the importance of good food, support the good food work of our community and institutional partners such as the Buffalo Public Schools, and advocate for a regional food system that promotes the health and well-being of all, both people and planet. In addition to the 5 GFPP values, our coalition prioritizes racial justice. We work to undo the racial disparities experienced by marginalized farmers and food businesses with an emphasis on supporting and promoting Black farmers. We intentionally use the term racial justice rather than racial equity. In doing so, we are emphasizing that not only must the outcome be just, but the process must be just as well. This distinction, we believe, is extremely important, especially in terms of policy development and implementation. The main points that I plan to explore today relate to the importance of local economies, and more specifically the local food system. I want to ground us in some context first. As is the case throughout the country, systemic oppression and discrimination is rampant in Buffalo. Due to decades of redlining, disinvestment, and government policy, Buffalo is the 6th most segregated city in the United States. And again, as is the case throughout the country, COVID-19 has highlighted these racial disparities in our city. We also have seen how COVID-19 has compounded the persistent health inequities in our Black communities, as zip codes with a majority of Black and POC residents have had the highest rates of confirmed cases. We know that access to fresh and healthy food significantly impacts health, and we know that folks with pre-existing health conditions are more vulnerable to COVID-19. So if we connect these dots, we see that an unjust food system is a significant contributor to the disparities that we have witnessed during COVID-19. COVID-19 has also demonstrated the gaps in the current industrial food system, and we have seen that food system disruptions in faraway places subsequently impact food availability locally. In other words, COVID-19 has not created new problems in our food system. It has exposed and exacerbated the hidden underlying systemic issues inherent to the industrial food system. Taking this a step further, COVID-19 has exposed why a strong and just local food system is essential. Not only does such a local food system retain and recirculate wealth into the community, but it also helps the region remain healthy and resilient during times of crisis. In response to the disruptions and exacerbated injustices caused by COVID-19 on our food systems, Buffalo's food producers, distributors, processors, food justice advocates, researchers, and many others have come together to form Seeding Resilience, a community coalition of over 80 organizations and individuals dedicated to creating long-term solutions to the exacerbated food insecurity in the city and surrounding region resulting from COVID-19. Grounded in the pre-existing community networks that have developed out of decades of grassroots food justice organizing, this coordinated response is developing a community food system organized by and for the residents of our region through which we work to meet our food needs. Seeding Resilience is showing us what a strong and just local food system could look like. However, due to the limited resources and capacity throughout the region, Seeding Resilience operates at a small scale, and we must still rely on the industrial food system for many of our food needs. While Seeding Resilience has been able to deliver hundreds of boxes of local produce, meals, and other food goods each week, imagine if our local food system had the capacity to do thousands. Imagine if we had a local food system that prioritized Black farmers and Black-owned businesses, and a local food system that addressed the food and health needs of our communities. Imagine how the pandemic might have impacted our communities differently if this was the food system that was supporting us going into COVID-19. While we do have the start of such a local food system, we need much more investment in it to be able to scale up these efforts and address all of the needs of our communities and our region. One reason we do not have a local food system with the capacity to feed our region is that most of our public dollars spent on food leave our region. As of 2018, Buffalo Public Schools had about 34,000 students and spent about $13.5 million per year on food. That was about 13% was spent on New York State produce. Investing that $1.76 million into the New York State economy is definitely positive. However, imagine the impact if that number grew. Imagine if that money could be directed to the Western New York food system rather than the state food system as a whole. Imagine if our public schools invested in Black businesses and built up the very communities that our children come from. Other regional public institutions, such as universities and correctional facilities, feed an additional 224,000 people each year. Imagine if these institutions, in addition to Buffalo Public Schools, invested a majority of their food budget in our local food system. There are currently 57,000 farmers in New York State. Of these, only 139 of them are Black. Imagine if our public institutions chose to invest their public dollars in supporting and promoting Black farmers. Increasing the demand for local food and food from Black farmers and Black-owned businesses could instigate a positive feedback loop in that the increased demand would promote the increased capacity of our region to provide the desired products. If this capacity increases, so does our ability to create a resilient local food system capable of responding to disruptions resulting from crises such as COVID-19. However, it's important to remember that building a strong local food system does not equate to a just local food systems. I want to call us back to the Coalition's emphasis on racial justice. While emphasizing local economies is incredibly important, we need to remember that the process, how we go about building our local food system, is critical. This needs to be a just process that supports community engagement and leadership, and that includes participation from all sectors of the food system. This process must include consumers, but it must also include workers, farmers, and many others, because we know that local food does not equate to healthy food or to safe and fair working conditions, or to good food grown in a sustainable and humane manner. Therefore, it is important that our public institutions use their procurement power to uplift values that include but go beyond supporting our local food system. We need a resilient, just, and sustainable local food system that prioritizes community health, well-being, and leadership. And we need our public dollars to help us build this. However, current New York State law constricts public institutions' abilities to support their local food system. While institutions can request food that has been produced and processed in New York State, they cannot request any other preferred geographic area. The public institutions in Buffalo cannot request food from the Western New York region specifically. This makes building up our local food system very difficult. Furthermore, it is extremely challenging in New York State for public institutions to align their food purchases with any value other than geographic preference. With few exceptions, contracts must be awarded to the lowest responsible bidder. In other words, the entity that has offered the cheapest prices for the bid requested. One exception lies in the New York State Best Value Policy, which theoretically provides an opportunity for public institutions to award contracts based on specific values, rather than awarding them to the lowest responsible bidder. However, in order to award a best value contract, public institutions must conduct extensive research and documentation to prove that there is a quantifiable and objective justification for choosing a more expensive product aligned with certain values over the cheapest product from the lowest responsible bidder. In addition, public institutions such as school districts must approve the use of the best value policy before this language can be included in requests for bids or in awarded contracts. Buffalo Public Schools has approved the best value language for procurement in service work, technology, or contracts for services. But food is not included in this list, which limits the district from including all 5 GFPP values in food procurement contracts. Finally, Buffalo Public Schools does have a policy that encourages purchasing from minority and women-owned businesses and enterprises, or MWBEs, which we just talked about a little bit more with Elizabeth. Yet this is still challenging for minority-owned businesses to get contracts with the district. First, in order to qualify for this prioritization, minority-owned businesses must be MWBE certified, which is a difficult process. Second, contracts awarded to MWBEs must be for at least $25,000 over a 12-month period. This serves as an additional barrier, as many MWBEs are small businesses and are often unable to supply the goods requested by such large contracts. Finally, MWBE contracts may be awarded to non-MWB businesses if those businesses commit to subcontracting out to MWBEs. While subcontracting might help small MWBEs to be part of a contract with Buffalo Public Schools, such an arrangement prevents the subcontracted MWBEs from being able to lead or control how they engage with the school district in the bid. Local and state policymakers can help break down these barriers. Only about 1% of local governments throughout the country view food as a priority, but COVID-19 has shown us just how critical a resilient and just food system is. It is time for local and state governments to step up and invest in community-led efforts to develop local food systems that are grounded in justice and well-being for all. Before I pass it off to Allison, I want to share my gratitude for the amazing people that are working on these policy efforts. The information that I just presented today is the result of coalition-wide work as well as collaboration with the New York City GFPP campaign. I'm so grateful for all of these folks. Finally, if anyone wants more information, or to continue these conversations, please feel free to reach out to me. My email will be on the final slide of this presentation. So thanks, y'all. On to Allison.
Hello, everyone. Three really great presentations, so I will try to bring it down to our local level. This is what decision-making looks like at the top of the food chain. As you can see, there's little to no diversity. There is some gender diversity here, but these folks represent who is making decisions in agriculture, nutrition, and forestry. Locally, we have a very strong Farm Bureau. There are no people of color as members of our local Farm Bureau. And our Farm Bureau works at the local level up the chain to these folks that you see represented here. So there's one side of issues being brought to the table for the major decision makers to take a look at and decide how policy will be influenced. With regards to nutrition, people of color are adversely affected by poor nutrition, and it's often due to lack of access and nutritional education. Again, these are the folks who are making decisions regarding the nutrition for our nation, and then again down to our local levels. So how do we grow without equity? On average, it takes 3 to 5 years for a new business to reach some level of stability, and usually 5 years is the mark of when you can say my business is strong and it will survive. For businesses led by people of color, and specifically women of color, it takes 5 to 7 years. And some people of color would argue with me and say up to 10 years for a business to be stable and some level of security that your business is going to survive for an extended period of time. And why is this? Well, there are barriers to entry. Knowing that you're going to have to put in a lot of time, maybe 5 to 7, maybe even 10 years of struggling to grow a business is not attractive to all folks. Even folks who have great ideas and have strong management and leadership abilities and could, on an equal playing field, create and sustain a thriving business. So these issues and the fear of failure, which most people have some measure of, discourage folks from opening a business. We don't get contracts at the same level as white-led businesses do. Sometimes the person in charge of the contract doesn't have the faith that a person of color can manage the business. It's a well-known fact that Black women and men, especially Black men, are not seen as leaders. We are not seen as folks who can lead organizations. We get used. And New York State has had to go through great measures to put quality assurance checks in place to make sure that businesses of color are not being used. There was a time that a business could look up a business that was MWBE certified, minority or women-owned certified, and put them down as a sub-awardee on a contract and be able to realize the benefits of receiving a lucrative contract because they were able to list that they had a minority vendor. New York State has done a pretty good job of putting quality assurance checks in place to do what they can to prevent this from happening. However, white males are able to put businesses in their wives' names and benefit from the WBE status. That is an extremely popular tactic used to start businesses and to see those businesses thrive. The USDA has a disadvantaged farmer program. However, that program includes white females. So white females who are majority owner in a business and their partner is a white male are benefiting from the same advantages that minority and women business owners are benefiting from. So again, there's not an equal playing field. So when you look around at businesses and you see who's thriving and who's struggling, I would just ask that you keep some of these things in mind. And if you're in a position to assist with changing any of these things, these are ways that you can help with equity and inclusion and work to make our food system a more just food system. This chart represents how small businesses can be profitable if you're able to get into the food chain and have some stability within the chain. As you can see, all the direct businesses were able to have increased revenue streams. If you are able to fit into the food chain for some extended period of time, the chances of you realizing a strong revenue stream on a consistent level are high. This slide, which we saw earlier, represents our food system. So as we go through each of the sectors of the food system, I ask myself, where do we see people of color? Food production. It was mentioned before, there are 57,000 farms in New York State, of which 139 of those farms are owned by people of color, specifically Black people. So how are we really a part of food production? Distribution and aggregation. Because these 139 farmers are spread out throughout New York State, it is difficult for us to aggregate. It is difficult for us to go to a Buffalo, Rochester, Syracuse, Watertown public school system and say, we can provide you with X at this level for X number of dollars because of distance. And do we own any distribution companies that would work in partnership with us to realize this opportunity to increase revenue streams? Food processing. There are no food processing plants in the entire state of New York owned by any African Americans. Marketing. When we go to do a marketing of our products, are there a number of Black-owned marketing companies to choose from to help us market our products or services? Here's where you do see us in purchasing. There may be some people of color working for large institutions in purchasing departments. Preparation and consumption. Here's where you see us again. We are consumers, and we do prepare in restaurants, in grocery stores, in small markets. Resources and waste recovery. We are not in waste management. So there are so many sectors in the food system where we are either non-existent or have a very small footprint. So the community impact. For example, if Urban Fruits and Veggies receive the contract, we are participating in local governments that help clients, public agency staff, and other consumers gain improved access to healthier institutional meals that have been prepared with fresh, high quality, and locally grown produce. We are a supporter of our local coalition working with the Good Food Purchasing Program because of this reason. Because 80% of the children in Buffalo Public Schools are Black. We, as Black business owners and Black growers, need to influence what those children are eating. If we receive a contract, there will be heightened attention to where one's food comes from. This helps to bring a greater awareness among community members and the greater public about the importance of strengthening sustainable and equitable local food systems. As a grower, specifically a grower in the city of Buffalo, we are strengthening our local food system, but are we receiving contracts to help us be sustainable and grow in the way that we should as compared to how we're strengthening that local food system? If we receive a contract, we can provide opportunities for programming and policies to encourage healthy eating, including nutrition education, fruit and vegetable prescription programs. We've run a fruits and vegetables prescription program for 4 years with our federally funded clinic, and we struggle every year to get funding for this program, even though we have documented data and documented results on how this is helping patients. We are now working on a COVID-19 diet for patients who've been adversely affected by this disease. Are we receiving funding and support for this work? I can tell you that we're not. So some of the other benefits to multiple consumers. When our public schools have an agriculture week and they don't invite any people of color or any businesses of color, and they're going to talk about agriculture in the United States, what lesson are 80%, again, of our public school children who are Black, what lesson are they receiving? Are they understanding the history of agriculture in this country? Are they understanding the history of land access in this country? Because the lack of land access contributes to the lack of generational wealth in the Black community. Our public hospitals, with the health disparities being what they are, and Erie County being one of the sickest counties in the entire New York State, are our public hospitals understanding the meals that folks should be getting when they're in a compromised state of health? Child care centers, all of these institutions would benefit from a more diverse food system. So building an equitable food system requires a focus on race, as everyone before me has so eloquently explained the details of why we need to focus on race in order to build an equitable food system. People of color are a growing share of the nation's consumers. We are amazing consumers as an African American population in this country. However, it is time for us to shed our high numbers of being consumers and be leaders and owners of businesses and have access to contracts that will allow us to realize increased revenue and begin to build on the generational wealth that is so desperately needed in our community. But we can't do that if we're not healthy. And this inequitable food system has a direct impact on poor health. And if you don't have good health, you can't work. And if you have poor wages, you cannot support your family. The obesity rate in the African American community is extremely high. Food workers earning sub-minimal wages, extremely high. An equitable food system would produce different outcomes by making healthy food available to all, by providing good jobs and fostering healthy neighborhoods. It would strengthen the economy by bolstering incomes, spurring business development, and contributing to equitable economic development in segregated and long-distressed neighborhoods. Thank you.
Thanks, Allison and Jessica and Elizabeth. So we did have some resources to share, but I think because we're short on time, we're going to try and get straight to the Q&As. I'm going to make sure these go out with the message with the link to the webinar recording that goes out. It should go out early next week, so keep your eye out for that. That's just a quick preview. We'll be sending those out. So as you're doing the QA, these are folks' email addresses. You're welcome to connect with us and continue the conversation. But I do want to flag there were a lot of questions. We're not going to get to them all, but I want to present some to these speakers. So the first one that folks might have something to weigh in on, for someone who's working, there's like a multi-county consortium for food procurement with a bunch of school districts to sort of leverage the volume of purchasing healthier foods. And there are efforts to prioritize equity, but not all of the counties that are part of that consortium prioritize equity. So how do you approach that when working with institutions or decision makers or policymakers to present that and encourage the prioritization of equity in their purchasing policies? And anyone can take that one.
This is Elizabeth. I'm happy to. So here's where I think we would engage in inside, outside, organizing, if you will. So in cities that we've worked with where the community members have said, we know that there are more vendors out here, more businesses, more farmers, more processors than who usually get these contracts. They have asked the city to, for answers like, why aren't you contracting with them? And they found champions within the city or the organization or institution that's purchasing who would support them. So it's like necessary to have that information out there for cities who have been able to do disparity studies, and many times because of that outside organizers demanding this information. Disparity studies have been done by cities. I'm thinking like New Orleans has done one, mainly because community folks have said, we don't think the city is spending enough with existing businesses owned by people of color. When those studies come out, it gives them that third-party verification of what they are feeling, and what they know in the community, and so that's helped to push cities and organizations to have relook and rethink their participation goals and how they actually utilize existing communities of color as contractors.
Hi, this is Jessica. I'd also like to respond to that question quickly, if I may. I would say one other thing is the beauty of food and the food system is that it's connected to so many other systems and so many other issues and values. And so as we go through this work, if we encounter folks who might not have the same values or might see things through a different lens, you can often reframe what you are working on to align with what they are working on. And so really thinking about how you're framing issues and how you're framing your ultimate goal can be very helpful.
Thanks. Allison, did you have anything to add to that?
No, I think it's been covered, and I agree with what Elizabeth and Jessica said.
Thanks. All right, well, I'm going to ping pong back to local economies. And this might be, I think maybe for Jessica, you might have more experience with this, but anyone jump in. Have you seen any cooperatives used as a strategy to pull products together to make successful bids with institutional buyers, and any tips for that?
Actually, I'd like to take that one.
Yeah, go ahead, Allison.
So, again, the difficulty is trying to aggregate. We, as a group of Black farmers throughout New York State, we would very much like to be able to respond to some of these requests for proposal. The challenge is geography, and the cost would be prohibitive to move, like, say, produce from a farmer in Binghamton to get it to Buffalo, or vice versa, to be able to meet those contract demands. So it's an issue that we're talking about and we're trying to work through, but it's a difficult one at best because of geography.
Thanks, Allison. And there's also a few questions about examples. Someone referenced San Francisco offering a price preference for minority-owned businesses and local procurement programs. Do folks have other examples of other cities or jurisdictions doing this as well?
This is Jessica. I do not. I was wondering if maybe Elizabeth would, because I also would love to hear if there are other examples.
I don't have any specific ones. I do have, I just do know that cities are definitely thinking about this if they haven't already implemented it.
Thanks. And another question that came up around MBE and WBE criteria, have speakers found it important to assist community members to know about those criteria and sort of helping them through that process? I think, Elizabeth, you talked about a bit about this in your section, but if there's any tips on that.
Yeah, I think I also tried to answer that. Yes, most of the cities that we've worked with, there were about 15 of them that wanted to improve their procurement practice. They spend a ton of time, have dedicated staff, and just in terms of doing like outreach and training, so folks know about what the value is of the certification. But they don't just go to where the business owners are, but they go over to their businesses themselves, because they know they don't have time to like look up all these certifications or go through the process. But they go to the churches, or they go through the barbershops, they go anywhere to engage folks in the community who might know a vendor who might not know of the opportunity and its value, and try to encourage them, because it definitely is a community effort.
Thanks. And I think I'll try and fit in one more question. And I think this is for anyone, but I think something that often comes up in doing this type of work is when engaging in values-based procurement as opposed to sort of lowest cost or opening and competitive, that someone loses out, that if you try to value one group or an individual, that someone else loses out. And I mean, at least from ChangeLab's perspective, we've moved beyond sort of the lift all boats approach, that you have to do targeted approaches and lifting some boats more than others in order to shift the distribution of resources and opportunities in a direction that promotes health equity. But I wonder if other folks also want to address that as you sort of engage in this work in the day-to-day.
I can address that. This is Jessica. I think one approach that at least our coalition has found really helpful is the process, which I touched on before. Just making sure that there are multiple stakeholders at the table and multiple voices that are being heard and that are involved in creating this process. It's not enough simply to say, okay, we've had stakeholder engagement or we've had in community engagement, right? We need leadership from these multiple stakeholders as well. So I'm going to leave it there. I'm wondering if Allison can also chime in.
Allison, if you're talking, it's on mute, or if not, we can pass it off to Elizabeth. All right, we might have lost Allison. Elizabeth, did you have any comment on that?
If you could repeat, yes, but if not, if you want to move to another question, it's okay.
No, I think there's sometimes a perception that if you do values-based that somebody has to lose out, and I think, as I said, that there's, I think targeted approaches are necessary because there's very inequitable distribution of resources and wealth, and that you do have to lift up some people in a targeted way in order to achieve community-wide health and equity. So if you had any other comments on that.
So we always say that might be challenging, especially during this time, to have an abundance mindset, but that's what is necessary to reimagine the system, and even for some folks to like reimagine something that is not based on the capitalistic system that we have right now. So I do think that we've learned in working with folks, and why I emphasize that there are race-neutral approaches and race-conscious approaches, is that when you do purchasing with your values and with intentionality, the idea of like a targeted universalism, if you support those who are most impacted right now by the system's inequities, you will improve the system for everybody, and that sense of abundance about will hopefully grow as well, because people will see the greater dynamism and interaction and partnerships that could be made available when you address those who are most impacted and use their solutions as part of improving the entire system.
All right, thanks, Elizabeth, for that response. So I think we're going to end it there. Questions or comments. As soon as this webinar ends, you'll be directed to a very quick follow-up survey. Please take just 2 or 3 minutes to share your feedback with us and help us shape this conversation into the future. A recording for this webinar will be available soon. You'll receive a follow-up email, and since we didn't get to go through the resources, I'm hoping to include those in that message. And finally, thank you to our speakers. I really appreciate them spending the time with us today, and thank you to all of you, the participants, for joining us for this conversation. And that's all we have. Thanks, everyone.